What makes the biggest difference in student success? Research says it's not just individual effort, it's collective teacher efficacy, the shared belief among educators that they can help every student thrive. Welcome to the Efficacious Educator podcast, where we uncover the stories behind this powerful idea. I'm your host, Sarah Bialik, and in each episode, we'll interview teachers and school leaders who tackle big challenges by working together. Discover what it takes to create lasting solutions, build trust, and transform school communities. This is the Efficacious Educator podcast, building better schools one collective solution at a time. Let's get started. Student mental health in the U.S. is at a breaking point. More than 1 in 3 high school students reported persistent feelings of sadness or hopelessness. Yet, despite the growing crisis, over half of children and adolescents with diagnosable mental health conditions never receive the care they need. Schools, often the first place where student struggles surface, are ill-equipped to meet the demand. A major reason? A critical shortage of mental health professionals. So how do we bridge this gap? How do we create systems of care that actually meet students where they are? Today's guest, Jessica Biggs, has been working on a model that does just that. She and her colleagues recently published a paper in the American Journal of Community Psychology on how community organizing can be used to build a coordinated system of care, connecting students with mental health support beyond the limits of school staffing alone. Jess is uniquely positioned to speak on this. She's been a teacher, principal, and now a policy leader, newly elected to the Chicago Board of Education for District 6. This election is particularly historic as it marks Chicago's first ever elected school board. She also serves as Regional Director of Healthy Chicago Equity Zone through the Southwest Organizing Project, where she works to address health disparities through community-driven solutions. Today, she joins us to discuss what it really takes to build a sustainable, community-driven mental health support system in schools. Jess, welcome to the Efficacious Educator podcast.
I'm so happy to be here and have an opportunity to reconnect and share a little bit about me and my experience. So thank you for having me.
Absolutely. Thank you for giving us your free time. Jess, your path in education is rich and varied. What initially drew you to this field? And how did your experiences as a teacher, principal, and leader shape your approach to community work?
Yeah. Well, I come from a family of public school teachers. So, of course, I intended to do anything and everything but enter education. As I finished my undergraduate work at Loyola in Chicago and was lucky enough to intern with a youth serving nonprofit that gave me my first job. And I was placed in a high school in the Edgewater neighborhood of Chicago and recognized right away that I was sort of running from the inevitable. I loved being around young people, connecting with them, hearing how they thought about the world, and very quickly recognized that I should be pursuing a path into the classroom. And so that's exactly what I did through Teach for America, which led me to the Bay Area of California, where I was a high school and then a middle school special education teacher. And that was really my first moment very vividly of recognizing the inequity between the schools that I had experienced and the schools that so many of our young people experience, and that there are so many of our high schoolers in our classrooms that don't yet know how to read, and that was not a thing we were thinking about systemically. Of course, I took on that challenge and that role as a teacher, and then really thought about how important it was to tackle that earlier and earlier in students' educational journeys. And that led me to desire a path into school leadership, where I was lucky enough to meet Sarah. I left California and had a chance to spend a year in Boston Public Schools, earning a master's in school leadership. Part of that desire was really to come back to Chicago to reconnect with, sort of a sense of place and history that is so prevalent in Chicago, And that very much informed my leadership as a principal. My leadership took a very different perspective. I've always believed that schooling is fundamentally a relational endeavor, and it has to be rooted in community, both within and around our schools, and that schools do not develop independently from the communities in which they sit. This was really central to my leadership as a principal and our school improvement process. I was presented with an opportunity to go to SWAP to sort of imagine what building a system of community partnership around multiple neighborhood schools might look like, and to think about doing that at scale. I was really intrigued. And so I took the opportunity and jumped.
Nice. So when you were teaching at the high school level and just noticing that students needed some early intervention. And that led you to focus your leadership on elementary education, really making sure kids get that early intervention for reading. Is that is that right?
Yes, it is. I remember an experience with a young man in my high school classroom who would come in every day and he would write his name on his paper and then he would sit very compliantly. I remember one day I pushed about why there was no further engagement, and that young man didn't come back to my classroom. And as I started to ask around, or other staff in the building said, well, he's not able to read. And I said, well, no, I had no idea. What are we doing? Like, what are we doing? Uh, and this was me as a first year teacher. And so I became very interested in the process of reading development and how we would wind up in a place where we had a sophomore in high school who doesn't yet know how to read and no tangible system of support for him. And so I spent 3 years at the high school working to implement a system of reading interventions, and then moved to one of our feeder middle schools. And then it was really in that space that I thought that school leadership from the pre-K through 8th grade space was where I wanted to be.
You wanted to get your hands on them when they were just young, ready to learn, sponges.
Yes.
So, your current role at the Southwest Organizing Project focuses on building equity in in health and education. Could you share the mission and vision behind this work?
Yeah. So SWAP, or the Southwest Organizing Project, or SWAP for short, we're a broad-based coalition of 40 some member institutions, local schools, churches, community-based organizations, some social service organizations that come together to identify issues of importance to the community and stand for the whole, so to speak. Our work is we work across multiple issues, 6 issue areas currently: education, health, immigration, employment, public safety, and comes out of what was known as the Catholic Cluster Project, really in the 80s, which was an effort to bring clergy together with other faith leaders on the southwest side of Chicago to respond to the racial tensions that arose out of the flight of white folks from the southwest side and from the city, as more and more Black families moved into the area, and to create spaces for folks to come together and build relationship and better understand each other, and work together. Interestingly, our demographics today are predominantly Latino, as we're seeing some other demographic shifts in Chicago. So that work is as important as ever. But that's really sort of some of the context around the history and the mission of.
I was wondering for other communities what the entity was that came in to really support building this. It's almost like a wraparound nonprofit organization to help everyone find each other. Does that seem like a very simple, but
And what I think is important about SWAP is that we don't think of ourselves as doing any direct service. We see ourselves as organizers who are responsible for being in relationship with community members, with our member institutions, really understanding what their changing interests are and finding areas of commonality. So that's looked like any number of things. Some of our youth engagement work been we were responsible for moving some legislation well over 10 years ago, a bill called SB 100, to reduce the school to prison pipeline and require a series of restorative practices and conversations as a part of schools' discipline policies throughout the state. We are the fiscal agent for the statewide parent mentor program, which is a program that identifies parents who have an appetite for public life and provides a small stipend for them to come and volunteer in classrooms in the school, helping to lead small groups. We've worked on a variety of immigration and healthcare issues. We recently worked with a campaign called Healthy Illinois to move health benefit for immigrant adults and seniors. Our work really does span the gamut.
So, the southwest side of Chicago is home to this diverse and resilient community that you've described. What are some of its greatest strengths, and what challenges have historically hindered access to essential services like mental health support?
Yeah. Southwest Chicago is a largely immigrant community. So some of the beautiful strengths are the relationships and the networks of relationships that exist between so many of our families, this sort of informal system of support, and the way that information moves um, through those relationships is a real asset. A number of challenges that are also very real for families. Language is an obvious barrier. Communication has often been fragmented around the sorts of services and resources that are available for families, regardless of their immigration status. As we dove into this work, we found lots of fragmented referral processes. There's a flip side to the strength of word of mouth, right? There might be a referral from a health center to a housing organization, but that was written on a piece of paper and given to a family without support or follow through to know what happens on the other side of it. And so many of those referrals would get lost. Some of the fragmentation really is around the lack of relationship of the institutions in the neighborhood with community members themselves, and the way that that inhibited families' ability to know and take advantage of the resources and services that many of those institutions do offer. So part of our work was to try to figure out how to break that down a bit.
Really, the communication, the ability to know what's out there. The institutions have their own cultures, each of them a little bit different, and that it was hard to coordinate or know who was referring who to what intervention, really, or service.
Right. And then when you have that fragmentation, right, you have a lack of trust, right? Sort of this other layer that can prohibit families from engaging in the sorts of things that would be supportive to them.
In your role as director of Healthy Chicago Equity Zone, what's a project or initiative you're most proud of, and how has it impacted the community?
The planning of the system of care work, um, which really launched in the fall of 2018. We started to pilot in the fall of 2019. We had this collaborative of healthcare, behavioral health, social service organizations, community-based organizations, neighborhood schools, and many parents who were acting as system navigators or community navigators, coming together regularly and in deep relationship with one another. And as we moved into March of 2020 and the pandemic, we had this really well-positioned group of people who were in deep relationship with families and community that could immediately pivot into this virtual world to figure out what supports do families need in this moment? How do we best communicate? We were able to lead all of the COVID response efforts in two zip codes, the most populous zip codes in Chicago, most populous zip codes in the state of Illinois, that were also deeply impacted by COVID. That work, which was done in partnership with the mayor's office at that point, became known as Protect Chicago Plus. And then as vaccine became available, it was that same cohort of folks really working together to move information around vaccine. And generally, if you pull a map of Chicago around sort of any social determinant of health, the map looks very much the same. We see sort of our north side lakefront areas doing very well, and the south and southwest and west sides of the city not doing so well. That work was very important, particularly around vaccine, because we were able to change the color of the map, where we saw southwest side and northwest side communities where this similar way of working was happening, become some of the most highly vaccinated community areas in all of Chicago. The relationships that had been formed through the Southwest system of care really enabled that very coherent response for our community, which has led into the Healthy Chicago Equity Zone work that I now lead.
The big reason that you're here is to discuss the paper that you and some colleagues wrote. The paper is called Using Community Organizing to Build a System of Care, a Mixed Method Evaluation. It is by you, Jessica Biggs, Catherine DiCarlo Santiago, Jasmine Serrano, and Vicky Rampala. Did I pronounce everyone's name correctly?
Correct. Yes.
This was published in the American Journal of Community Psychology. And the paper really explores how community organizing can shape a system of care. Can you break down the organizing framework you and your colleagues used and what makes this approach different from more traditional top down initiatives?
So the concept of a system of care is not a new concept. The fact that we bring youth and family serving organizations together and ask them to figure out how to collaborate for better, more coherent care. But those models are typically led by departments of public health, large healthcare institutions. They had identified the southwest side of Chicago as an area that would benefit from a coordinated network of youth and family serving organizations. And initially went to a large healthcare system and asked them to lead this effort. That healthcare system spent a year in a planning process that really got mired down in folks' inability to agree around a data sharing agreement, which is fascinating. That healthcare institution chose not to continue into a pilot phase, and the foundation still wanted to see a system of care developed in our neighborhoods. And so, sort of happenstance, heard someone from SWAP speaking about some of our parent mentor work and thought, this would be very different, but I wonder if this organization that currently acts as a convener around so many issues might be able to take this on. I think it worked well in part because SWAP's self-interest in this work was very different than that of many of the other institutions that were coming to the table, right? We don't we don't provide direct service. Everybody else operates on a fee-for-service model. Aside from standing for the whole, seeing the growth of overall health and well-being in the neighborhood, didn't necessarily have a vested, clear interest in any particular outcome or direction that this work would take. That's really a large part of what made it successful. All of our work is built through one-on-one relationship building. And an idea and definition of, we use the word power, meaning power with one another. And when there is a set of interests that are aligned, that we're really able to move big things that we're not able to move on our own. So our process really centered on an initial series of one-to-one meetings with leaders of many of these healthcare and social service institutions to understand exactly what was their interest in engaging in this work. Was it around having higher show rates for appointments? Schools had a very particular set of interests, making sure that their counselors that were serving anywhere from 400 to 900 students in one school had better support for both their children and families. It was both a relational process and a relationship building campaign to understand those interests. But then when convening people, both giving space for all of the planners in the room, including parents from our schools, to engage in one-to-one meeting time every time we came together so that they were also getting to know each other as humans while we were lifting up these sort of bigger picture interests that we needed to figure out how to solve together.
You highlight a growing need for accessible mental health services by families. What were some of the most pressing barriers for families faced in showing up for appointments or any of those things when this work began?
Those things were pretty complex. In some cases, right, those were transportation issues. In many cases, those were right, issues of scheduling time around employment, where so many of our families, right, are working multiple jobs. The number of clinicians available, particularly for counseling, if there's not a clinician who's ready and available to see them, that delay can really play on that trust factor. What we sought to address with the role of the community navigator was just even knowledge of a variety of resources. So, right, many families might present in a particular circumstance, but really all of the factors that were underlying that circumstance were pretty complex, right? Whether it was an issue of housing or it was an issue of employment. So I think initially I remember we recognized right away that we didn't have enough institutions sitting around the table. We worked with an organization in Chicago called Neighborhood Housing Services. We brought some of SWAP's housing organizers to the table, found ways that Catholic Charities could support with rental assistance. Um, so brought some new entities to the table, but also just made sure that in our care coordination meetings that we always had someone who could speak about the sorts of supports that might work for a family. And then we went and sought out additional organizations that could support families around employment.
So, in this system of care that you've defined in this paper, a couple of essential components: there's schools, there's the mental health providers. Now you've got housing, employment. Ultimately, what were the essential components and what makes an SOC truly effective, or the Southwest SOC truly effective?
So we actually started with a youth development framework in deciding what sorts of organizations should be at the table and made sure that we had organizations representing each part of that framework. Employment and housing weren't necessarily immediately evident, but then were included at the table. We also invited our youth development partners, so folks who were providing after school care, some of our youth organizers who might be able to provide additional mentorship in a non clinical capacity or could lead groups of young people in schools. Those were the core array of services that we were looking to be able to provide families access to. But I think what we learned through our evaluation process and what really comes out in the paper was just how critical the role of our community navigators, parents who were already working in the schools, many of whom had come through SWAP's parent mentor program, really leaning into them as both experts in their communities, as people who were in deep relationship with multiple networks of people, both inside and outside of their schools. The development piece from our perspective was, how do we make sure that this group of navigators is also in relationship with key people in each of these service providing institutions? Spent a lot of time, multiple times a year, going to each of our service providing partners so that our navigators could see the space, could talk to people who provide services, could ask questions that they had heard from families of those service providers. And really, they became the bridge in a whole number of ways to make sure that families were successfully connected to the resources and services that they were seeking in a way that was warm, that was supported all the way to the point of service.
So the community navigators are really the superheroes of this story, that they are really the bridges between families and CBOs, community-based organizations. What were some of the things that you and your organization did to support growing the skills, capacity? You mentioned that you went and visited the places, got questions answered, but was there any specific work that they did around this idea of being a warm place for families to be received?
We worked with actually several of our partners around some of this. So they participated, our navigators participated early on in a regular clinical support group, both for their own wellness and to also share the stories and experiences of their work with one another while supported by a clinician. We partnered with St. Anthony's Hospital that did a really relational mental health first aid training. So, not sort of your typical mental health first aid. It included those aspects, but also took a really relational approach. And then, we're organizers. So, spending time talking about public life skills and thinking through and practicing one-to-one meetings and emphasizing that as a framework that we wanted our navigators to be using with families and schools to build relationships, not just to provide services, but to really understand the whole of who a parent is or who a staff member is as a means to both build relationship and trust, but then also be able to better assess and connect to resources that might be supportive.
So then in the middle of all this, you've already started, and then COVID-19 comes, and you've already mentioned that you knew it was going to impact this community in particular in a much bigger way than other communities in Chicago. So in some ways, it was almost like you were set up to have a whole system of care before this huge kind of existential threat came for us all. Could you talk a little bit about what the reassessment looked like? Okay, we've got COVID-19.
So there were two things happening. One was, right, this connected community that existed was figuring out how to operate in this COVID world. And locally, we were lucky to have leadership in our mayor's office that recognized pretty early that if they were going to be successful in responding to COVID, that they needed to be in relationship with community, listening to community, and providing resources where, when, and how community said that they needed them. And so I'll never forget a call that I got. I think it was like 8:30 or so on a Thursday evening from our deputy mayor of Health and Human Services, and said, "Hey, we're thinking about this model where we would ask people to captain some of our most impacted zip codes or co-captain with the mayor's office. Is that something you think you could do?" It's like, well, sure. I don't totally know what this looks like, but yes. So, um, became a part of what our mayor's office called the Racial Equity Rapid Response Team, which was a convening of community leaders from across the city to think together about COVID response in that space with the mayor's office, but then also had senior leadership from the mayor's office that was regularly participating in a weekly convening of many of these partners to say, where should testing sites be? Here's where they are now. Here's what we're seeing all the way down to census tracts in terms of where COVID cases, hospitalizations, and deaths are. So we're providing data in a very meaningful way. At the same time, they were listening to so many community members about what that meant for what our messaging should be for that next week, who should move that messaging. So many of our navigators, and we were able to hire more community members as a COVID response corps to distribute PPE door to door. They started their own food delivery service for families who were quarantining and isolating in partnership with food pantries. Um, so it was a really, and then disseminating information about where testing was available and also advising the mayor's office about where testing should be. So that's what that looked like initially. And then, of course, like I named, when vaccine became available, all of that work immediately pivoted to vaccine education and outreach in a very similar way.
I mean, just think of all the heavy lifting that would have been involved if this community of care wasn't in place. So, that's a great story. I have a quote from your paper, and it says, "Building power across individuals and institutions depends on strong relationships rooted in trust, shared interests, and a shared goal of improving the whole community's wellness." Can you walk us through how trust was initially built between schools, families, and community-based organizations? What were some specific action items on your agenda when you came together?
So I talked about this one-to-one relational meeting framework as a building block of community organizing, which is a very countercultural thing that we would invite someone for a conversation in a meeting. And the goal of that meeting space is really just to get to know their story, understand what moves them, That framework was not only used by me and other organizers on the team, but we also brought that into our convening space. And we're really transparent about this is a countercultural thing. We're going to ask you to do it, and would commit at least 15 minutes of each meeting space to relational meetings, and then encourage people to continue those conversations outside of our convening space. We were also really intentional about saying, in order for this to work, we need you all to know each other, like know each other as whole humans and your stories and what brings you to this work. Um, that was one of the really small pieces, but we were really intentional about it consistently throughout both our planning and our reflection every time we convened together.
You said you had to say this is countercultural. Did you find resistance within the team of navigators to being in relationship, the CBOs?
Not necessarily our navigators, right? Because these are mostly women who have come through SWAP's organizing and leadership development framework for many years. There was a real willingness on their part, right? In part because this was something that they were used to doing, right? And are good at it. I think it was countercultural a lot more for leaders of institutions who we can be so focused on the work and the problem at hand that you're asking me to take minutes just to share my story. I think it's just a little bit uncomfortable for people at first to get into that way of operating. And some people just really sort of settle into it. I think for other people, it's harder. So that certainly varied across the group.
So as organizers of these meetings, you had to, even though not everybody valued it in the same way, you had to stick with it and continue to set aside time, even when maybe people are feeling urgent, wanting to get things done on the list. But we're going to take this time and we're going to know each other.
Yes, absolutely.
So bringing schools and community-based organizations together to align interests is no small task. So, what were some of the key activities that helped stakeholders move from these siloed efforts to a truly collaborative partnership?
I'm happy to share with you the actual logic model that we came up with in the end. But we started with big picture brainstorming around what we wanted to be true. One of my first jobs was to go through that big brainstorm and distill that down to some common themes, and then build consensus around is this what we hope would be true if we're successful? And that was, held up at each meeting. And then we went back very concretely to what are the assets, resources, and needs of our schools. At that point, we were in the planning process. We were working with just 3 schools. And so I prepped each of those counselors to walk us through what resources did they have available, what challenges did they feel like they were unable to meet, and what sorts of gaps did they experience. We went through an exercise several meetings in where then I asked some of our service providing partners to look at some of these gaps that had been articulated and identify ways that they might be able to concretely meet them. And so there was this back and forth of group thinking and sharing in a convening space. Is this something we think we could do? Is this actually meeting the need that was identified? That was largely the process that we went through to figure out what were the core activities of our model. And those core activities really came down to this group of community navigators, right? And the sorts of functions that we wanted to make sure that they were able to perform. It was around the sorts of convening and collaborative spaces that we wanted to have inside and outside schools. It was around what kind of communication tool we would need in order to be successful. I tackled that one last, knowing that the first project really got mired in this data sharing agreement. We got really clear first about what we wanted this tool to do. And then, very luckily, the University of Kansas had recently developed what they called their IRIS system, or the integrated referral and intake system, which seemed to just sort of check all of our boxes as a tool that would allow us to refer and talk to one another, to follow referrals to completion, that wouldn't require some deeply complicated data sharing agreement because we were sharing minimal community member information through that tool. So those were really kind of the core pieces that came out of that planning process.
This is what we want. If this is what we want, what's it going to take? What do we need to do to make that vision a reality? Some gaps that they had that they needed others to fill, and then your CBOs had some time to say, here's how some ways we might be able to fill those gaps. You moved people to the harder part, which is really tracking this and looking at some progress, like a tool that actually could say so and so was referred, did they get the services?
Yes, absolutely. I think that's a great synopsis.
Okay. So in the end, how did these groups, the families, schools, and CBOs, arrive at a shared set of goals? What was the process just to really drill down and say, here's where we're going?
Those goals were things like an improvement in overall community well-being. They were things like improved relationships between institutions, between individuals and institutions. So pretty abstract. As we started to figure out how we wanted to operationalize our work, I mean, it was both a moving backward from the vision as well as moving from the activities, right, to this middle point of how do we know if we'll be successful, right? What would this actually look like as an indicator of moving towards improved community wellness, right? Or moving towards improved relationships or better coordination of care and services.
Could you give us an example of one of the indicators?
So one of the things that our referral tool allowed us to do, we started to think of the number of referrals that a family was involved in as a proxy for care coordination. So if more than one member of a family was enrolled in a particular service, there was some coordination of care happening. Or if there was one member of the family that was enrolled in services from, let's say, neighborhood housing services, as well as had been connected with a primary care physician through one of our federally qualified healthcare partners, that there was some care coordination happening and multiple needs were being met. So we used that as an early proxy for knowing whether or not we were moving towards greater levels of care coordination.
We only have a limited time left, so I'm going to wrap this up a little on the paper side. But from your perspective, what have been the biggest wins so far? And on the flip side, what challenges remain?
What our evaluation revealed, even on the quantitative side, we saw significant and measurable reports of an increased sense of care coordination, an increased sense of communication between service providers, increase in parents' perception of the quality of services that they were receiving. So that was really exciting. And much of that was echoed in the qualitative work. One of the things that didn't show up as a quantitative outcome, but did show up in our qualitative data was parents' sense of self-efficacy, whether or not they felt like they had the ability to go out and get the thing that they or their child needed. We didn't see movement on the quantitative side, but we did on the qualitative side. In the qualitative evaluation, parents talked about being able to do that with a community navigator. The question in that survey didn't make any reference to, feeling a greater sense of self-efficacy with anyone else. Just could you do this on your own? And so that was really learning for us just about how critical the role of the navigator was in all of this work, and sort of reinforce this idea about the strength and power and necessity of being in relationship with one another in order to be able to thrive and get the things that we need. But we didn't see anything really statistically significant as reported from our community partners. And we also don't see a lot of referring going on between our community partners themselves. We see almost all of our referrals initiating with our community navigators. We have another entity of folks as a part of the Healthy Chicago Equity Zone work called public health ambassadors, but we haven't necessarily seen a major shift in the way our partners are connecting and sending people back and forth to each other at this point. So that's still work that we have to figure out in the future.
So it's really you open the door for that communication to happen, but there's some work to be done. So I have a person with a housing issue, and one of the things that's going on is that they also need help with a student who has a mental health issue, and that housing place isn't going to refer them to the mental health provider when they learn about that.
Correct.
Yet.
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 All right. So one thing we did learn together in grad school is that leadership matters in making systemic change. What were some of the most important leadership moves you or your colleagues made to really help elevate and embed this work across the community?
A leadership move that I made in this space that I don't think I always made in previous roles was just how important my own story and my own vulnerability was to connecting with individuals in a way that helped us both move towards action. So me getting really familiar with and comfortable with my story and sharing was a leadership move that I made that I think was really effective. Strong facilitation of groups where you're able to ask really clear questions, summarize a group's thoughts, and take them and move them to a tangible thing and actually follow up on that. That is a skill that I have honed over and over and over again, and I think has been a key leadership move in this work. Knowing where your expertise stops and starts, leaning into community members to tell me what exactly things should look like, what will and won't work, what people are actually wanting. That's been really critical too.
Not getting tied to our own solutions, but really deeply listening to the actual solutions that are going to work.
Yeah.
So your work is deeply tied to the concept of collective efficacy, but it's broader than just a single school. It's this whole community of Southwest Chicago. How did building this system of care increase the collective efficacy of families, schools, community-based organizations?
Yeah, well, we're seeing our neighborhood schools have access to a holistic realm of resources and supports for their families and students that they didn't have access to previously. We're seeing community based organizations that, whether or not they're referring community members directly to each other, are at minimum in relationship with one another and much more intimately aware of the kind of work that each other does. We've seen, we've seen well over 10,000 referrals for service happen since the start of this work, and we were able to respond to a global pandemic in a way that, was pretty effective. I think those are a lot of wins.
Congratulations. You can't ever measure what didn't happen, but I'm sure you could compare similar communities to Southwest Chicago and see how much better outcomes were. I'd be really curious to hear if that data ever comes up in your work. Sustainability is always a challenge in community-driven initiatives. What are the next steps for strengthening and sustaining the system of care long term?
This role of the community navigator, right? And I didn't even talk about the community employment piece that came out of this work that still lives as a part of this work, but figuring out how to continue to fund people operating in this sort of role is where I see the greatest sustainability needs. Many of the individuals that we work with, right, will never be able to, bill against Medicaid, even as we have an expanding definition in our state of what sorts of community health worker services could be billed through Medicaid. So I feel like that's a space where we're always going to need to see some sort of philanthropic support and funding for that work, because I just don't know how it fully gets funded publicly. So that's something I think a lot about. And then, I have this hope for the strength of relationships, whether or not there is money to bring people together. I don't think those relationships, they don't disappear. They continue to carry on, whether or not there's a foundation moving the work forward or not.
So, if there was someone out in this world listening to this podcast, what might be some ways to support the Southwest Organizing Project and really continuing to fund the superheroes of this story, the community navigators?
On SWAP's website, there's a donate button, so that exists, and you can say specifically what you want that money to be used for, and it would absolutely go to good use. I think talking to anyone in the philanthropic space that that there was a lot of energy during the pandemic. People started calling community members trusted messengers. And I think encouraging philanthropy to continue to fund roles like that for a variety of needs, pandemic or no pandemic, is a space that folks could certainly advocate around as well.
I'll put a link to the Southwest Organizing Project in the show notes if anybody is interested in donating. Doing this work is demanding. What keeps you going each day?
Walks outside in the sunshine. I really think it is the energy of being connected to community. I really thrive in community, in authentic relationship with people, in spaces that I get to continue to learn and grow both about myself and about others. And this work provides the opportunity to do that every day while I get stretched. I get to think about really hard problems and how best to solve them and take people's input. So all of those things keep me going for sure.
Jess, this has been an incredible conversation. Thank you so much for sharing your time, your insights, your passion with us today. For those of you who want to dig in deeper, I'll be linking the full paper in the show notes. And if listeners want to get in touch with you, Jess, they can find you on LinkedIn.
Yes, I am on LinkedIn. It's me, Jessica Biggs.
Jessica Biggs. Okay. Thank you again. And to our listeners, as always, let's keep working toward a more efficacious education system for all, using Jess and other folks who've been on the show as reminders of how to do so. Thank you for being here, and we'll see you on the next show.
Thank you, Sarah.
Thank you for listening. I hope today's episode leaves you feeling empowered and optimistic about solving even the toughest of challenges with your own team. If you enjoyed the episode, help us grow and reach more listeners by 1, sharing the podcast, 2, subscribing so you never miss an episode, and 3, leaving us a review. I promise to read and respond to everyone. Your support means so much. Thanks again, and see you next time on the Efficacious Educator Podcast.